I am a stay-at-home mom of two small kids, and about 3 years ago I went to the ER. I was suffering with shoulder pain radiating down my left arm and into my hands. I woke up that morning with my left hand being numb and the back of the hand feeling very like it was on fire. And so after going to the ER, they ruled out no heart attack, no pinched nerve in my neck. So I went to the orthopedist who I'd seen several times, and he said that he didn't know what was going on. It was probably diabetes related. I've been a diabetic for 32 years, and so it seems like when doctors can't find the reason behind the problem, a lot of times it's attributed to having diabetes. So he prescribed some medicine and said if that didn't work, come back, he'd try something else. So that got me to thinking that maybe if it was diabetes related, I should see a neurologist. Went to the neurologist. He conducted a nerve conduction study and said there was nothing wrong. It showed absolutely nothing, that I should maybe just rub some sports cream on it and they would follow up later. I was crying because I was in such severe pain with the back of my hand burning that I was referred by a friend who mentioned Dr. Itchurts. So I thought, well, I'll try one more doctor and see what he has to say. I was just extremely frustrated with the pain I was going through every day. I called the office, the staff got me right in, and after visiting with Dr. Itchurts for like 5 minutes, he says, well, you're suffering from a compressed ulnar nerve, which comes from your elbow. And just hearing the diagnosis made me feel 100% better, knowing that I finally had an answer and it wasn't in my head, or it wasn't diabetes related. And he explained the procedure and said, we'll see if we can get you into surgery quickly, because the ulnar nerve had been compressed for so long with my last two fingers being numb, that he wanted to fix it right away. And so I believe I was scheduled within the next day or two for surgery. And as soon as the surgery, that evening when I came home, the burning pain was absolutely gone. And he explained before the surgery that it would take some time for the nerve to regenerate to get that feeling back in my last two fingers. And I had some muscle atrophy and loss of hand strength in the left hand. But that is since I've gained all that back and no damage. And I thank Dr. Itchurts that he was able to diagnose the problem and get me to use my left hand again, because with the two small children, you can't just not deal with that. So, and within the last couple of years, he's also helped me with some trigger finger problems that I had where my fingers would get stuck in the same position. That was very painful. And then also, I had some carpal tunnel done on the right hand. And I was very, very impressed, because in years past, I had the same problem with the left hand. And when he went in and did the same problem on the right hand, I had no scarring whatsoever that I can even really see. And the recovery time was really fast comparing it to the orthopedist who did the surgery in years past. So I've been very, very helpful, or very, very satisfied with what Dr. Itchurts has been able to do for me.
And you have full range of motion?
I have full range of motion completely.
And your strength has returned?
And I have strength now, and just like it was before everything happened. So I'm very, very happy with what Dr. Itchurts has been able to do, because living in chronic pain is no way to live, and it will wear you down. And if you have chronic pain or any pain at all, and you've seen other doctors in the past, and don't give up. Just go and make the call to Dr. Itchurts. They'll get you right in, listen to you. They treat you like a person and not a number. I've been to physicians in the past where they just want to get you in and get you out, and he's very committed to the outcome of your progress and the work that he does to help you feel better and get out of that pain. So I'm very happy.